One of the key concepts in a neural organization technique is the cranial injury, or the head trauma. When people hear this, they always say, oh, but I didn't go to the hospital, or but I didn't pass out. If you look at the brain, as we explained in a previous video, it sits inside these 29 bones, nice and nestled. But when we take forces that we didn't see coming, the brain can actually slosh inside because it didn't have time to arm itself. And so inside there could be brain bruising. Now many times what happens in what they call concussion is you have to go off to the hospital, and then they can prove through their MRI or CAT scans that they can see a significant bruising or a shadow spot on the film. But in our work we don't always look for that. We don't wait till it goes to that level. What we want to find out are the switches back on and reset it right there. So most of us really have had some kind of a head injury. The car we didn't see come from behind us, or that football check that came, or when my mom almost dropped me down the stairs, or even slipping sometimes. Slipping backwards and catching yourself can do it. Many of the patients that I work on, they'll show a cranial injury and they'll say, I don't remember one, but when we trace it back, it shows, yes, they were skiing or they were skating. So it's not a thing to say, oh, it's bad that I had a head injury, or that I had one or didn't have one. It's lie down, and there's some specific 2 points we can check, or there's 2 or 3 different ways to check, is there what we call in our work a cranial injury complex. And that cranial injury complex, there is a program to hold your head on your shoulders. If it is working and it's neurologically organized, its function is to hold this gyroscope up, and it will stimulate all the muscles of the back, front, and side of your body. However, if you have taken a disorganization and the body could not reset, the body now says, I am hooped. I am a weaker animal in the jungle. I cannot afford the next blow to the head, or it could be my last. And so what they instinctively do is stay clenching the whole skull together. And the brain then stays shrunken down inside, even though there's no threat, but the body's saying, I'm staying stuck in fight-flight because I cannot afford the next trauma. So the body's actually doing the right thing for you. It's keeping you alive. It's just saying, I wish somebody could reorganize and reset me out of that injury, and then I could be free to come back into the present moment, which is what we do.